After having had so much Botox, there are things that I really loved about it, but I noticed certain things, like my masseters were gone. So I had a lot of laxity and jowling in the jaw area, and I just had no structure to my lower face.
I don't really have lines on my forehead, and I think it's really the diet. We also want to eat a low glycemic load diet, so we want to keep our blood sugar stable. This is also important for keeping the wrinkles at bay, preventing premature aging, because a high sugar diet is also going to degrade our collagen and cause the lines to show up sooner than they would have otherwise. Apple cider vinegar to some water before meals is really good to help keep your blood sugar balanced and to aid in digestion. So you could just put a couple of teaspoons or even up to a tablespoon in a small glass of water, and you just take that before your meal. Having a lot of anti-inflammatory foods, it's eating enough protein and having enough collagen in the diet and keeping the blood sugar stable. Because we do know that a high glycemic diet can create inflammation, and that basically degrades our collagen and can lead to premature aging.
Welcome.
Thank you for having me.
You have incredible glowing skin.
Thank you.
We're sitting like 2 feet across from each other, so I get a great view here, and it's amazing. I would love for you to start by just telling everybody what you do.
Yeah. So my skin routine is more of an internal skin routine. I'm actually very minimal on the topical stuff. So I really believe that the healthiest skin starts with the healthiest gut and the healthiest diet, the healthiest lifestyle. So for me, skincare is eating a nutritious diet, lots of anti-inflammatory foods, low glycemic foods, collagen-rich foods. Probiotics are super important for the gut. And in terms of other things that I do for my skin, keeping my stress low as possible, I think that really makes a difference. And interestingly, there's actually science to show that when we're stressed, it disrupts our gut, creates inflammation, and it shows up on our skin as breakouts and even premature aging. So I would say healthy diet, trying to keep my stress low as possible, although it's not always easy. And then topically, I just use literally cleanser, maybe a serum here or there, and a moisturizer, and that's it.
Do you have any like ride or die non-negotiables, or is it just whatever you have on that day?
I love jojoba oil. I just use that to take my makeup off at the end of the day. Then for a cleanser, I really like, I kind of switch between like whatever I'm in the mood for, but I like Eminence. They have a probiotic cleanser actually, which is amazing.
I know that one.
Yeah. And then I also like Kovo. I don't know if you know this brand, Kovo Essentials. They have a turmeric cleanser, which is really nice. And then, there's one other brand. Actually, there's an esthetician based here in LA, Brigitte Tolson. She has a something called Daily Detox, which is a face wash, and it's amazing. So I kind of cycle between those. Yeah.
I need to try that.
Yeah, it's really good.
Some of the biggest skincare lies that we are fed, I saw that you did a post on this, and I thought that it was a good entry point for this conversation because a lot of them are things that, so many of us internalize and we are led to believe, like preventative Botox, and we're not going to go off on Botox this entire episode, but I did want to get your take on it.
Well, I guess we could start with the preventative Botox.
Let's do it.
Yeah. So I know you had some issues with Botox. I did as well. So I never did it in my face, but I'm talking like almost 20 years ago, I did it under my arms to stop sweating. And it just was the worst thing that I ever did. And is actually a big reason why I'm so into wellness, because it created a lot of problems for me where my lymph nodes were swelling. And I'm talking for like days, weeks, months, years, kind of coming and going. And that's what really got me into like sauna and, exercise and all these other things that we need to do to support our health. So preventative Botox is a scam. I think that we, telling 20 and 30 somethings who don't have lines yet that they need to do it is not really the best thing for them, because what we know now is when you freeze these muscles, they can atrophy over time, and then you just end up needing more of it and kind of paradoxically sometimes looking older when that's not, you were trying to get the opposite effect. Another myth, I think the biggest myth around acne is that it's caused by bacteria. It's not. It's actually caused by inflammation. So I think it was like early 2010s, acne was actually reclassified from a bacterial infection to a chronic inflammatory skin disorder. So that should have really changed the way that we treat acne, but it hasn't. So we're still kind of treating the same. Antibiotics are the most commonly prescribed medication for it. And even topically, we use a lot of antibiotics or antimicrobial washes and serums and things. But really, we need to target inflammation. And inflammation starts in your gut, starts with your diet, starts with your stress. And that's really where we need to be targeting first to reduce that inflammation. And then once we do that, that can reduce the inflammation in the skin and reduce our breakouts.
I love how you peeled back the layers, essentially, where it's like people are kind of looking at the most upstream thing, right? And you're looking at the downstream, which I love.
Because I think we really need to go to the root. That's the only way that we're going to get to the heart of the problem, is to really look at the root.
I would love to rewind to the Botox thing a little bit, because I had the same experience, not with like the adverse effects that I had, but when I look back on my face after having had so much Botox, there are things that I really loved about it, but I noticed that certain things like my masseters were gone. So I had a lot of like laxity, I would say, and jowling in the jaw area. And I just had no structure to my lower face. And I also noticed that my eyes were kind of downturned. So I think that was from, really trying to hit the area for the crow's feet. And, that was in my 30s. So I can't imagine what's happening when you're going in every 3-4 months, starting at the age of 20, like you're saying.
It's a lot. And, Botox, it's a toxin, right? It's really one of the most toxic substances known to man. So I think there are numerous reasons why we should be more cautious. Everyone needs to decide for themselves like the pros and the cons, right? But I think that I would like to see a world where we're not pushing this on young people, especially because it's just an added stress and something that we don't need and they don't need.
Can I ask, what were your symptoms after you had it? Because I know that adverse events usually happen after therapeutic Botox, which is something like for under your arms, for dystonia, for migraines, where they have to use a lot higher doses, although they do happen after cosmetic as well. Did you notice?
Yes.
I've never met somebody in the flesh who's had it, just people online.
So my lymph nodes were swelling, like it was literally like a golf ball under my arm, which is really scary. And that literally went on for years. It started a lot, and then kind of gradually would come and go, but over the course of years. I also developed an autoimmune condition called morphia, which is actually, you can still see it here. Like, you see my skin's discolored. Mm-hmm. So this arm was actually the worst arm that had like the biggest lymph nodes. So this skin became like a whole sheet of scar tissue. It literally looked like just a big piece of scar tissue. So it looks, you kind of almost can't tell. It's a bit red now, but you know what I mean? So it's just kind of red, but it used to be just a flat, shiny scar tissue, which I've done microneedling on, which kind of got rid of, some of it. But so that was like the biggest thing that happened.
Wow.
And again, this is like almost 20 years later, which is crazy.
And you've never done it in your face?
Never done it in my face.
Okay.
No, because I was so terrified after that.
So what are you doing for your face? How old are you, if I can ask?
I'm 38.
Okay, so we're the same age.
Yeah. So I do face taping, thanks to you.
Oh,
so, yeah. So I think it really works. Face taping is amazing.
Yeah, your forehead is like it's like an ice skating rink, which is what we love.
Thank you. So I actually feel, I don't really have lines on my forehead, and I think it's really the diet, honestly. I think it's having a lot of anti-inflammatory foods. I think it's eating enough protein and having enough collagen in the diet and keeping the blood sugar stable. Because we do know that a high glycemic diet can create inflammation, and that basically degrades our collagen and can lead to premature aging. So I do think that's what's helping my forehead. But for me, like, it's more the crow's feet over here. And I'm telling you, it like really works. And it works quickly too, which is amazing. Yeah. So
it's
I do
amazing.
that. What else do I do? I think bone broth is helpful. Again, just having collagen-rich foods. And I would say those are some of the things.
I mean, because you think about younger people, and you even look at kids and teenagers, and they have full movement, but then the skin bounces back. So it's not about inhibiting movement. And I remember after I had to stop getting Botox, and then we'll move on from this. I went to a friend of mine who's a plastic surgeon, and he was like, you actually look younger, because a telltale sign of age, especially here in LA where people just take everything to the nth degree, is a completely frozen face, because that just shows that you're trying to, get rid of all of your movement.
Right.
So people who are older tend to have that. So a little bit of movement is good. And I love seeing it too in people now.
I think it's beautiful. A couple years ago, I went to Norway for a hiking trip. And one thing that really struck me is that while I was there, all of the women, like, they were just aging naturally. And they were just so strong and so healthy and so vibrant. And they looked great, they looked great, and you can tell that they lived a good life, and I think that's a beautiful thing.
So let's go to the gut, since that's the root of everything. What are like some of the best and worst things that we do for our guts?
We can start with the worst things, the bad stuff first. So definitely too much sugar, refined carbohydrates, and processed foods is not great for our gut. That can wipe out some of our good bacteria. Too many vegetable oils also are not great for the gut. But basically what the research shows is that gut dysbiosis is responsible for a number of chronic inflammatory skin issues, including acne, psoriasis, rosacea even. There seems to be a gut root. So for acne, a lack of the good lactobacillus and bifidobacteria strains has been linked to acne. And we've also found that acne patients tend to have more leaky gut than people without, and they also tend to lack enough strain, so they don't have like good gut diversity. We know for psoriasis, there is a big association with increased intestinal permeability or leaky gut. Rosacea, there is a link with SIBO, which is small intestinal bacterial overgrowth. So more and more research is really showing that the gut and skin are very intricately connected. And so we really need to make sure that we're replenishing that good bacteria in our gut, because modern life seems like it's made to deplete those good bacteria, right? Stress depletes it. Processed foods, modern foods, taking antibiotics or certain medications can deplete it. Tap water, all of these things can take an effect on our gut. So it's really important that we're actively adding them back in through fermented foods, through taking probiotics, and really making sure that we're getting our gut back to a good place.
Do you recommend that people get a stool test to see where things stand? Okay.
Yeah.
Before they just start taking probiotics?
I think doing a gut test is really great. If you have any sort of chronic skin condition, it's a really good place to start, especially if you've been doing all the things and the topical things or even other things and it's not working. We need to get to the root. And a lot of times skin issues are starting in the gut. So yes, doing a comprehensive stool panel can be a really great place to start to see if there's dysbiosis, if there's leaky gut, and if there are certain strains that would be most beneficial for that person.
I think when people hear gut health, gut issues, they tend to think digestion and issues with that as the first symptom that they might experience that something is amiss or if there is dysbiosis there. But is it possible for somebody to have perfect digestion and be having skin issues or other inflammatory issues and have an imbalance there?
It's unlikely for someone to have skin issues and not have gut issues, to have chronic skin issues, I should say, because inflammation really starts in the gut. So the way that it starts is actually with a leaky gut. And what happens is when our gut is more leaky, bacteria, toxins, undigested food particles, these can leak out into the bloodstream. And then the immune system comes in contact with them and tries to fight them, right? Tries to take care of them. And in doing so, it creates inflammation. That inflammation is now in your bloodstream. And so that can go anywhere. And it often, for some people, it goes to the skin and creates an inflammatory skin issue. So I would say it is possible to not really know that you have digestive issues. You don't necessarily need to have chronic bloating or pain or anything like that. But it is likely that, constipation, diarrhea, bloating, so there's probably some digestive issues going on there.
Talk about some of the vital signs of the body, especially when it comes to your gut and going to the bathroom, things like that people should be looking for. Because I know that then affects things like hormones and your liver, right? All of these things are tied to that. So what should it look like for people?
So we should be going number 2 every single day, maybe even twice a day. And if you're going once a day, you could actually still be constipated if you're not eliminating completely. So it is really important that you get your bowels moving. That is really number one key to clear skin, is making sure that you're regular. Because that does aid in hormone balance, like you said. So the way that the body gets rid of excess hormones is the liver would break them down and then send them to the stool to be excreted. And so what happens if we're constipated is that those hormones can actually get reabsorbed back into the bloodstream, contributing to imbalances. So for anyone who has hormonal acne or period acne, definitely make sure that you're going regularly and completely. So things that can help with that are things like fiber, water, movement, and probiotics. Strains like L. rhamnosus, SP1, L. acidophilus, the bifidobacteria, these are all going to be really beneficial for that.
Even things like histamine. I mean, I've been talking about that a lot because that's something that I've been dealing with. My long-term thing from the Botox incident has been histamine intolerance and mast cell issues. And I know that, that's so important too for clearing the histamine out of your body. And I think that so many people are dealing with those kinds of issues as well, unknowingly.
And that's why it's really good to go to a practitioner, especially if you've been trying to do everything yourself and you can't find the solution, it's not working, because it's different. So every single person who has acne is not going to have the same exact root cause. There'll be similarities, but for each of us, it's going to be a little bit different. And so the best treatment plan is going to also be a little bit different. So that's why it's really important to figure out what your unique root causes are.
Let's talk food and the gut and skin and the connection between all of that. And hormones come into play as well there. And I was talking to the founders of ClearStem recently, and we were talking about that and how a lot of people are told, oh, it's hormonal acne. And it's like, well, yes, it's hormonal acne, but the solution isn't necessarily to treat the hormonal issue because something is causing the hormones to become imbalanced. So it's like exactly what we're talking about. It's peeling those layers back and getting deeper to the root. So what are the best ways that we can support our bodies and support our hormones and all of that through the food that we're eating? And I know that you also like to talk about the order in which we're eating things.
Yeah, so definitely when it comes to hormonal acne, and I will say that to some extent, all acne is hormonal because it's hormones that control the sebaceous glands. So there is a hormonal component, across the board. But in terms of getting our hormones into balance, I would say eating enough fiber is really important because, again, that's going to help with regularity. Cruciferous vegetables are really important. Those support our liver's own, natural detoxification processes and helps the liver to better process toxins and hormones. We also want to keep our stress low, make sure we're sleeping because stress can negatively impact our hormones. And very importantly, we also want to eat a low glycemic load diet. So we want to keep our blood sugar stable. This is also important for keeping our skin keeping the wrinkles at bay, preventing premature aging, because a high sugar diet is also going to degrade our collagen and cause the lines to show up sooner than they would have otherwise. So those are some of the really big things that I think we need to focus on.
Talk about that process a little bit.
Yeah. So with keeping your blood sugar stable, there's a few things you can do. This doesn't mean that you never can eat sweet things ever again. It just means that we want to choose wisely and, be very intentional with what we're eating. So first off, whenever we can, we want to choose whole carbohydrates instead of refined carbohydrates. So refined carbohydrates, things like cakes, cookies, candy, bread, all that kind of stuff. Anything that's made with a flour is a refined carbohydrate. Your whole carbohydrates are things like brown rice, sweet potatoes, wild rice, quinoa, all that kind of stuff. So when we can, we choose whole. The fiber and the protein that is present in the whole grain is going to keep your blood sugar more stable than anything that's refined. Secondly, the order in which we eat foods is really important because if we have our high carbohydrate food first, that our blood sugar is going to be affected more negatively than if we ate a meal first and we had the sweet as dessert. So try to have your sweets as desserts, not as snacks. So don't have like a 3 p.m. cookie. If you want the cookie, have it after your lunch or after your dinner. Also, the order in which you eat your foods, ideally you're having the fiber first, so your vegetables, and then you're having some protein, whatever that is you want, and then you're having the carbohydrate. And even if you eat the same exact meal, like let's say on 2 different days, the same amount of food, everything's the same, except the order is different. The meal where you eat in that order, you'll actually keep your blood sugar more stable than if you were to eat the same meal, but eat the carbohydrates first.
Why is it fiber first and not protein first?
So the fiber actually creates like a protective sort of film or mesh that is going to prevent some of the carbohydrates from being absorbed in the gut. Yeah.
Are there any other little hacks that you like around eating that you feel like have made a huge impact for you?
Yes. Okay. I think making half your plate vegetables at as many meals as possible is a great little hack. It's very easy to remember. You could have any type of vegetables you want, cooked anyway, however you want. But making sure you're making half your plate veggies is going to help you get enough fiber and various different nutrients, antioxidants that are really important for our health, not just for our skin, really just for overall. So I'd say that's a big one. One that I kind of cycle in and out of, I don't do this all the time, but especially if someone is dealing with hormonal acne or is currently eating a diet that's more higher glycemic, adding apple cider vinegar to some water before meals is really good to help keep your blood sugar balanced and to aid in digestion. So you could just put a couple of teaspoons or even up to a tablespoon in a glass, small glass of water, and you just take that before your meal. That can help there. And I would say eating dessert last instead of having, snacks like sweet snacks during the day.
It's funny because I feel like I used to have such a crazy sweet tooth and it kind of comes and goes. But I would try to hack that by actually eating my dessert earlier in the day because I felt like, okay, well then, like if I'm craving something, I'm just going to have it and then I'm not going to have it at night. And I feel like it's more detrimental to me at night. Like if I'm eating before I go to bed, a bunch of sugar versus during the day, like I'm still going to be active. I'm moving around. So, I have more time to metabolize that, I guess.
Well, it's always good to prepare it whenever you have it, whatever time of day. It's always good to pair it with a source of protein and fat. That is also going to help keep your blood sugar more stable.
Are you like very, very pro protein? Like
I'm not like
it sounds like you're more like vegetable fiber.
I'm balanced.
Okay.
I'm all about the balance because I think, I've been in this industry for a long time now and I've seen the trends come and go and, one year it's vegan, then it's paleo, then it's keto, now it's, carnivore and protein is the star of the show. And I think what ends up happening is we focus on one thing and we forget everything else. And so that's not the way that we're supposed to eat. We're supposed to eat a balanced diet because each different type of food is going to give us different benefits and different things that we need. So yes, we need to eat enough protein, but we also need to eat enough vegetables and fruit and, healthy fats. So it is really important that we're balanced.
Yeah, and I feel like people tend to hyper-focus on protein, especially when it comes to skin and collagen and elastin and all of that, whereas I like how you are mentioning that stress is such a huge part of that and blood sugar is such a huge part of that, and maintaining those things and keeping that balanced can do so much for you, more so than like maybe eating a steak every day.
And one thing I've noticed, I was actually just saying this the other day. So nutrition is so powerful. It is literally the building blocks for our cells and for our organs, for our blood, for everything in our body. So nutrition is super duper important, but our body is connected. So our mental thoughts are not disconnected from our physical body. They're connected. And so they can really affect us. And if you're eating healthy, but you're so stressed out about it, you're doing yourself a disservice, and whereas someone who is maybe not eating so healthy, but is really calm and chill, they're probably going to be healthier than the person who's eating healthy and stressed. So again, it's all about balance and making sure that we're not hyper-focusing in one area and neglecting the others.
Yeah. Well, I feel like that even in my own life, where when I'm here in LA and my schedule is really crazy and I'm stressed all the time and I'm eating really clean, I'm preparing a lot of my own meals and everything, but I'm just like not always feeling that great. Yeah. Whereas then I go on vacation, I'm eating out all the time, I'm eating kind of whatever. And I feel amazing and my body feels amazing and my skin looks amazing. And it's like, I have to look at, well, what is the common denominator here? It's like, it's not the food. Sometimes it's the food if you're getting like way better quality, but stress really
takes a toll.
Yeah, it really, really does.
There's actually an interesting study that was looking at the impact of stress on premature graying of hair. And what they found is that you can actually reverse your gray hair by not stressing out. And there was actually a clinical trial where they looked, they followed people for a length of time and found that, when they're on vacation or when they're, there's periods in their life where their stress is a lot lower, the hair actually reverses back to the color. And then of course, when you're under stress, it turns gray. So stress is really not something we want to let build up. It's something that we do. Like, it's impossible to avoid stress, I think, in this day and life. but we need to find ways to better manage it and how we react to that stress and not let it really eat us up.
Could you imagine if we all just lived like on an island and no stress? We would all look like babies with like amazing hair. But yeah, it's interesting. I feel like people push back on that because everybody says, oh, well, graying hair, that's genetic. But genetics essentially like load the gun. Sorry for that analogy, but the environment is going to pull the triggers. And you can see in a family, one person can have really gray hair and the other person might not. And the lifestyle could be completely different.
Yeah. I mean, there's a whole field of epigenetics, which is looking at exactly that. It's how our diet and lifestyle influence our genes. And even with gray hair, so because I've been kind of experimenting with myself and reversing my own gray hairs.
Yeah, you don't have any.
Well, there's a few hidden under there. But I've actually found there's a couple of other things besides stress that are helpful. So one, increasing circulation to the scalp. So doing head massage, like hair oiling is really helpful. You could even do acupuncture to the scalp to help bring circulation there.
Great for your face too.
Yeah, great for your face. And then another thing that can cause premature graying is high heavy metals. So if you're eating a lot of sushi or fish, you could have high heavy metals, and we want to get those down and also make sure we're having enough minerals. So high heavy metals and low minerals can also cause premature graying. So we want to correct that, and that can also help to reverse.
If you have high heavy metals, do you have to like quote unquote detox that, or is there a way to just kind of bring your body back in balance? I mean, can they get out themselves, or do you need to force them out?
You need to force them out.
Okay,
actually,
how do you do that?
It really depends. So it depends like what your levels are, like what you're dealing with, and it's always best to work with someone to help you with that, because they can give you a very specific protocol tailored to you. But yeah, basically you would want to include things into your diet that are going to help detox the heavy metals. You want to also increase your minerals as well, making sure you're having a lot of minerals. Things like sweating can be helpful. If you do have very high levels, then a practitioner can help you with chelation, might be necessary. So it really depends on what your levels are and, what you need.
Are there any other things that people can look for in labs that might be contributing to premature aging or skin issues? I mean, we're talking about acne as well.
Yeah.
I'm sure that there are markers there.
For sure. So for acne, it's really helpful to get your blood sugar, like your blood glucose levels and your insulin levels. That's really helpful. And sometimes, you can hear something like, oh, a high glycemic diet is not great for your skin. But it's another thing to actually see your lab work and be like, oh, okay, maybe I do have a high glycemic diet, So I think, looking at your blood sugar and insulin can be really helpful. Certain nutrient deficiencies are associated with acne. So vitamin A, omega-3, and zinc are some of the biggest. And oftentimes, the worse the deficiency, the worse the severity of the acne. So doing that kind of testing. These tests can be a bit expensive. So again, working with a nutritionist who can kind of look at your diet and say, you're probably not getting enough of this or this, so why don't we test and just make sure? Or you seem to be eating a lot of the stuff. So maybe it's not that you're, if your levels are low, maybe you're not actually absorbing it. So maybe the issue's in the gut, so it is good to work with someone to kind of help guide you there.
With all of the things that we've been talking about, how do you get quote unquote glass skin? I saw you did a post on this, and I'm sure that it incorporates pretty much everything that we're talking about here. But you see so many things online about how to really achieve glass skin. So what do you think are like the core fundamental things?
So number one, I would say actually don't do too much to your skin. Don't use too many topicals, because if you have a 30-step skincare, you're probably disrupting your skin barrier, and you might actually make it more sensitive and prone to redness and inflammation than if you're
where I tap out.
I know. Nobody likes to hear this, but that is my belief.
Every time I talk about my skincare routine with anybody in the industry, they're like, "How do you have skin?"
Well, maybe you're making it more resilient. Sometimes.
But Candace put me on it, and I trust her wholeheartedly, and it changed my skin from like cystic acne and so sensitive, and
So, but you know what? It's always good to have a personalized routine, I think, because
for sure.
again, everyone's different. So I would say that's really important. I think getting your gut in order is really, really important. Like I truly believe, I think probiotics are the future of skincare. They can really change your skin from the inside out. So much so that I actually formulated a probiotic called Glow Biome that has 6 clinically backed strains that support that gut-skin connection. And it really can transform your skin from the inside out. Another thing that I think is important, again, is going to be keeping your blood sugar stable. I know I keep harping on this, but it's really everything, even for, again, like the forehead, for preventing the lines and things like that. It's really, really important to keep your blood sugar stable. Eating anti-inflammatory foods, fruit. So actually there is a study on women who consumed vitamin C versus those who didn't. And the women who consumed more vitamin C rich foods actually had less wrinkles and lines on their skin versus age-matched people who, were not having vitamin C. So I do think that eating a nutrient-dense diet is also key. And then I would say, incorporating things into your life that are going to help you with the stress. For some people, it's meditation. For some people, meditation's not for them. But
stressful for them.
Yeah, it's stressful for them. Go into nature when you can. Go for a walk. Find a hobby. Do exercise. Whatever it is for you that's going to reduce stress, I think that's really important to include into your daily routine for your skin. I know it sounds crazy, but really, our diet and lifestyle are skincare.
I love that because I think that people focus on the external things. What can I buy? What gimmick can I get? What procedure can I do? What skincare can I use? And all of those things can help, but you really have to have the foundational things down. It's like almost like you can't out-train a bad diet. Like you can't, I don't know how you would change
you can't
that.
Out skincare.
Out skincare like a bad lifestyle. I don't know. Like you can't.
Exactly.
I mean, you could probably. And when you're 20, yes, you absolutely can.
But yes,
which
as
is why
time goes on.
Yeah, which is why I think it's so funny when I see like these younger girls, and I mean, good for them. They're into skincare and taking care of themselves. I was not at that age. Like it was not a thing. We were in tanning beds, like smoking cigarettes all day, like baby oil on our face at the beach. We were just not, it was a different time. But I also feel like at that age, like you can enjoy, sleeping in your makeup and
you don't have to
4
worry
hours
about
of sleep and you wake up the next day and you look amazing, which is so funny. But I feel like in our 30s, I don't know about you, but I noticed around like 36 is when things started changing.
For sure. I feel the same as you, Yeah, in the 20s, you can really get away with anything. And then in your 30s, you're like, no, I need to pay attention here. I need to do some things. I agree.
And I feel like, I think that there are different aging peaks. I can't remember where they are, but I think there is one maybe in like the mid 30s for women or late 30s. I don't know. It was hard to tell when I just had Botox in my face all the time because nothing was moving and it looked great. But I did notice like skin quality things.
It changes. You know what? And we're living creatures, so it has to change. So I think we just need to accept it more. And it's hard because most of society doesn't, right? And with the filters and all that doesn't help, right? Because we're expecting to look like perfect porcelain dolls or something, but it's not the reality.
But also we're damned if we do, damned if we don't. So, it's like if we get things done, then we're vain. And if, God forbid, somebody has a bad outcome, then, people get dragged. And I may have talked about this in a different podcast, but I had pop apologists on my show and they were talking about like the Lindsay Lohan, Demi Moore, the glow ups, the Anne Hathaway now is another one. And people like are worshiping these women who get good surgery, and then women who don't have good outcomes, who are in the public eye, get dragged as though that's what they wanted. Like nobody wants to go in and get plastic surgery and come out and not look good, So it's like the surgeon's skill is, I think they said, either like their virtue or their flaw, which is not fair for women. But especially like being public facing, which you are and I am, it's tricky because you see yourself and you want to look and feel your best. But then if you do, it's just like there's no winning.
Yeah, you're right. And that's why I think everyone just needs to do what feels best for them and kind of like close out the noise, because people are always going to have an opinion, especially if you put yourself out in the public. Like whatever you do, someone's going to fault you for it, good or bad. So I think that we just need to kind of, it's hard. It's easier said than done, but like, put the blinders on or the earplugs in and kind of tune those people out.
Okay, I want to go over some trends. How do you feel about castor oil?
I love castor oil.
You do? How do
Castor
you
oil is
use
amazing.
it?
So actually, yeah, putting it on my face. I don't put it on the whole face, although I have before. But I just kind of like put it on this area. I feel like it's helpful.
She's pointing around her eyes.
Yes, pointing around my eyes. But also, so I had a baby recently and I got a postpartum hernia, which is like a little, basically your intestines pop out of your belly button, which is really lovely. But I was using castor oil and that actually helped. Putting it in my belly button actually helped to reduce inflammation and to reduce it like quite significantly.
Wow.
Yeah.
So the castor oil in the belly button, you think is legit?
I think it's legit.
Okay. I haven't gotten there quite yet.
You got to try it.
I have the castor oil for my brows and my lashes.
Oh, yes. I do use it for that also. It helps.
Yeah, you have great brows.
Thank you.
What do you do?
I'm Italian, so I was born that way. I love it.
I love it.
They used to be like twice the size, and then I just like threaded them. So now they're
so
here.
Good. I love when like give genetics credit where it's due.
Yeah,
I feel like not enough people do. Okay, face tape. We talked about that a little bit. Are you doing the Natural Face Bible?
No.
Oh, which one are you doing?
I don't know. I mean, I just kind of throw it on there, to be honest.
But where do you buy it from?
I couldn't even tell you. I know I have a pink one and I have a brown one.
Okay.
It's a Japanese tape. That's all I know. I don't know what the name of it is.
Is one like harder and one is softer? Or
they're both pretty soft.
Okay.
Yeah. And I'm on the beginner one.
Okay.
Like I
maybe from Catherine Romaine.
Yes.
Yeah.
That's yes.
Yeah.
That's yes. Okay. Exactly. Yeah.
Okay. And you said that you do your forehead and your eyes?
I basically just do my eyes.
Okay.
Yeah.
And are you doing what's your application?
So I put one here, like this. Try to get this. I basically smile. And then I put it like over where, and then I put one here as well.
So she's doing like one under the eye and one kind of over the brow area.
Yeah, for that.
Yeah, it kind of opens up that muscle.
But Catherine Romaine is great, and she has like all these. So I did get her course, and she has like applications for like lymph drainage and all that stuff. But I don't know, it was just too much for me. I couldn't.
You can get really, really in depth with it. Did you know Donna Omari? Noise Skincare. She was like a skincare angel. She passed away like maybe a year ago, but she came on my podcast years ago, maybe 2021 or 22. And that was when I was like doing Botox fillers, whatever. Yeah. And she sent me like a reflexology tool and a gua sha and face tape after that. And I was like, thanks, but I don't need to tape my face. And now I go back and I look at her videos and I'm like, God, she really knew. She had this quote that was like, there's no tool nothing can surpass like the power of your hands.
Yeah. So I think I've heard that. Yeah. I've heard that quote. So I do think also face massage is amazing. And you can see the difference. It's crazy. I remember this was during COVID times. I committed to doing 30 days of like face massage for, I think it was like maybe 20 minutes a day, which is a lot. But I thought I looked good before, but when I saw the after, I was like, wow, like this is crazy. But it's so hard to do. So honestly, now I just pay someone like once a week to do it. I can't.
Kosha Spa here in LA. That's my face massage place. Yeah, it's hard to commit to that time. It's like you would rather just get in, get out, go there for an hour, right?
Yeah,
and like
exactly.
Be lifted for the week. But I see all of these videos going around. I don't know if you've seen them on Instagram and TikTok of dermatologists and surgeons, and they're rating beauty trends from a 0 to 10, right? And so, of course, they're like face tape, 1, face massage, -2, and it's like, and then sculptor a 10, Botox 10, filler 10, and it's like, okay, I don't know. I just wonder, it's like these things really do work. There are alternative modalities to lifting and brightening and smoothing the face. And no, it's not going to be the exact same as either a surgery or a neuromodulator or a filler, but don't discount them, because there are so many people who don't want to or can't do those other things for whatever reason. And I just think that it's very like dismissive of a whole group of people, whether they're pregnant, they can't afford to, they have autoimmune, whatever their reasons, And so it's nice to hear just anecdotally that like it does work, and it does, and it makes sense. Like, I don't know, I wake up so puffy, like all these antihistamines that I'm on, or if I eat something, or if I sleep funny, and it's like you can move that. You can drain that out of your face. You can like shift things. Maybe you can't shift your bones and everything, but you can get a lot of improvement. Same if you got lymphatic drainage or massage every day on your body. Like it does look different.
Exactly.
So.
And a lot of surgeons, after you do surgery, will suggest the lymphatic drainage.
I know.
But I think,
the irony.
Right.
And they tape. They tape for swelling.
But I think the issue is that they're not taught about these things in school.
Yeah.
So they don't really know, and they maybe are not inclined to do it for themselves. And so they don't know. And I think the best thing that we can all do for ourselves is just experiment. Experiment for yourself and see for yourself if it works, because there's not always a double-blind placebo-controlled study for every single modality or thing on the planet. And if it's cheap, like face massage is free. You just need some time, or a face tape is a couple bucks, you can try it and see for yourself.
I always say big tape isn't out here supporting the double-blind placebo trials. Okay, let's see. Gua sha.
I like it, but I just don't use it, to be honest.
It's so funny. I go through phases where I'm so consistent and I'm like, wow, this is amazing. And then life happens. It's hard. I think we're all doing our best, right? Yeah. Cupping. Do you ever do facial cupping? Or does your massage place do it?
Yeah, they do. The massage place does it. Yeah.
What about red light therapy?
Yeah. So I haven't gotten into it. I actually got a mask. I wanted to ask you, because I know you have, do you have the bond charge mask?
I have quite a few.
Okay. So I put it on. I bought one and I put it on, and I thought I was going to go blind from the red light in my eye. It's so bright.
Yeah, you need to put on the
goggles. But even I put on the goggle things, and I could still see the red light through these blackout goggles. So I was like, this is probably not great for my eyes, because my eyes are sensitive. I know you also have light eyes. So I don't know. What are your thoughts on that?
I have not had that experience. I mean, you can lower the intensity also. I don't know if you tried that. So doing a lower intensity with the shields in.
Yeah.
That's usually fine for me. I also like to use the Loom Box.
Okay.
So Loom Box is from Plateful Health on Instagram. She's amazing. Dr. Vivian Chen.
Okay.
So she's an MD doctor, and now she's like very into holistic modalities, and she actually wrote her thesis years and years ago on botulinum toxin, which was really interesting. But she partnered, or she created, I'm not sure her affiliation with Loom Box. So it's red light and near infrared light, but it's a box, and it's super powerful. Like, I think one of the most powerful on the market. And it's great because you can set it up like, I don't know, a few feet away from you, and it can hit like face, neck, chest. Like, you can put your hands. It's also great for injury. I've used it on my boyfriend's back when he like pulled his back out. And that comes with goggles, and you can do just near infrared. So there's no red light for those deeper layers, or you can do the red light. That one doesn't bother my eyes ever.
Okay. I'll have to try that.
So that's a really good one. And it's good if you want to use it for other things. Like, I know people use it on their head. They'll use it on their neck for neck pain. Like, use it on your, wherever. It's kind of easier than a mask because it's just a box.
I'll have to try that, because the science behind red light is, pretty convincing. Yeah. So definitely.
But it's another thing that you have to be consistent with. Yeah. I had Dr. Dennis Gross on the podcast, and he was like, it's an ingredient, think of it as an ingredient. It's like your skin will need that ingredient multiple times a week for X amount of time. So it's another
thing to add to the to-do list.
Yeah. I mean, I feel like I've gotten it down where like when I do all of these things, I can do it in like 20 minutes. Like, I can do a 5-minute gua sha, a couple minutes cupping, a couple minute massage, skincare, or red light skincare. But it's hard. It's like the most effective thing is going to be the thing that you can do consistently, I think, when it comes to any of these. What do you think about overnight collagen masks?
I don't have a strong opinion one way or the other. I mean, I see people posting them on Instagram and their skin looks great. But I don't know. I haven't tried it personally, and I haven't, necessarily like looked into the research behind it. So I'm not sure. Is that something you use?
I tried one of the viral ones, and it wasn't like not what it was cracked up to be. Yeah. And now all of these brands are stealing my content to sell their collagen masks. So I'm like, if you have to be doing that, then you can't be that good.
Oh my God.
So,
yeah,
but
terrible.
People love them. I mean, I know even like estheticians and people in skincare who love them. So
yeah, I don't know. I always gravitate towards the internal things. Like, I think bone broth and like collagen-rich foods, like, whenever you have fish, eat the skin. That's where marine collagen is coming from. I think that is really helpful to get it from the inside. Also, vitamin C rich foods help your body.
Any other like weird things? Not that fish skin is weird, but that people wouldn't think of. Like, I don't know, sardines. I know sardines are really good for you.
Great. Yeah. Sardines are great. So also meat stock is something that I've got into. Like, everybody knows about bone broth, but meat stock is similar, but instead of using just bones, you're using bones that have meat attached to them. And it actually makes a ton of collagen, and it's very, very healing for the gut. So if you have any leaky gut, It's amazing for that. It's amazing for your skin. So, and you can't really buy it anywhere. You do have to make it, but it's actually very easy. Like you literally just put the bones in the pot, add some water. You could add some herbs or spices and you boil it, so
Amazing.
It's not hard, but it's a long, it's another thing to put on your to-do list. Yeah.
Well, all of these things are self-care, right?
Yeah.
So it's like you can decide how far you want to go and what you want to incorporate. Are there any, what would be the 3 non-negotiables that you would say, just to close it out, if you could only pick 3 things?
Yes. Okay. A nutrient-dense, low glycemic, anti-inflammatory diet. Number 1.
I love it. You're cramming a lot into that
one. That's your well-balanced diet. Okay. Number 2, I would say daily probiotics. And number 3 would be some modality that you can use to reduce your stress, whatever that is for you.
Amazing. Well, tell everybody where they can find more information on you and follow you and all the things.
Yeah. So my website is mariamarlowe.com, and Marlowe is spelled Marlowe. I'm also on Instagram with that. TikTok and YouTube is Glow by Marlowe.
Amazing. Thank you so much.
Thank you.